Hello, my name is Clive Loseby. I want to talk to you about this. 5 years ago, the wonderful NHS saved my life. And every day, ever since, this has not only kept me alive, it's allowed me to live a full and active life. The reason I'm making this video is because I have discovered that very few people know about this. And I want to get the message out there because I know this will help people. I have a condition called bronchiectasis. This means that I am not able to clear my lungs properly. And for years I was getting repeated chest infections and I was on antibiotics pretty much consistently. About 5 years ago, I picked up a nasty superbug called Pseudomonas. It's very tricky to get rid of. I was on a nebulizer at home by then, and I had antibiotics through that every morning and every night for months. Still could not get rid of it. The doctor at the hospital had suggested that I came in to have antibiotics intravenously for 2 weeks. I said that was impossible. I was too busy keeping the business going, managing everything at home, keep juggling everything. There was no way I could take out that amount of time. So I said, I'm really sorry, but I can't do that. Now, when a specialist at a hospital suggests a course of action to you, you really need to take it on board. 4 years ago, Easter 2016, I had a sudden onset of pain in my back about there. It was absolutely horrendous. I was crying out in pain. I couldn't speak. I could barely breathe. It was just awful. My son rang an ambulance and I was taken into hospital and diagnosed with pneumonia. The Pseudomonas had got completely out of hand and had spread, and I was in a very, very bad way. I stayed in hospital for 2.5 weeks and they really did look after me. They were amazing. They also put me on antibiotics intravenously for 2 weeks, and surprise, surprise, that actually got rid of the Pseudomonas. Yep, there is a lesson learnt there. But the other thing that they did is that they put me on this amazing pulmonary rehab course. It was just incredible. It was a series of lectures to understand my condition and how to manage it. And then the other half of it was circuit training, because my fitness was absolutely terrible. When I got to the end of the course, they had felt I wasn't quite getting the message, so they made me do the whole course again. By the end of it, my fitness had literally doubled. They also showed me how to use this. It's called an Acapella Active, and I want to show you how it works. So, I've opened it up. Have a look inside there. You can see this plastic flange. It's on a rocker. See that vibrating? So, you breathe in, this vibrates a lot. It sends sonic waves down into your lungs. You do it 10 times, you take a breather, another 10 times, take a breather, and so on. What that does is it stirs up all the stuff down at the bottom of your lungs that I can't get rid of. And because it's loosened, I can then hook it up, put it into one of these lovely sample pots. Now, I do this 3 times a day. And by the end of the day, the contents of this are looking pretty grim. But I find it incredibly satisfying because that is the stuff that would otherwise have been on my lungs. In the last 4 years, I have not had to be readmitted to hospital. Not only that, I haven't needed any antibiotics. Well, apart from one time, I got a bit slack. I wasn't doing this perhaps as thoroughly as I should have been, and I wasn't doing it 3 times a day. Consequently, chest infection, needed some antibiotics. That was it. One time, the Pseudomonas came back, and I managed to get rid of it with this. If you have COPD, bronchiectasis, or cystic fibrosis, or something like that, speak to your doctor, get a referral to your hospital, and get assessed. It might be that this can help you. There is an absolute hideous virus going around at the moment, and it's attacking the respiratory system. You want your lungs to be in the best possible condition that they can be. If you know anyone who could benefit from this, please share this video. Thank you for watching. Stay safe.